I am Dr. Paul Gibbs. I am a board-certified internal medicine and geriatrics. I work for Baptist Health Primary Care. Geriatric care generally applies to anybody over 65 years of age. Once you get into the older age groups, you don't treat somebody at that age the same as somebody that's younger. It's important to know the difference between medications. The medications change, the dosages change. You have to know the potential side effects, cross-drug reactions. People that are specialized in geriatrics tend to know more about side effects with medications to avoid potential complications. Primary care is important because it's the stepping stone. Your primary care is basically the one that's coordinating your care. If you don't have a good primary care doctor, a lot of things get missed, and they're usually the ones that have to put everything together. If you're a primary care physician, you're really the one that's kind of in charge of the patient, and you work with the patient to get the best diagnosis and the best treatment. And the main advantage is going to be with the continuity of care, team approach. The patients have access to the specialists, which you don't see in a lot of other healthcare settings. I think it's always important to have empathy, especially if you know people that have gone through the same things as the patients, or if you've gone through it, you can relate to them, you know what they're feeling. And I think that actually helps the patient to understand. If you have empathy, the patient themselves will feel better and they'll trust you more. Maybe look at me more than just a physician, maybe as a friend, somebody that they could talk to whenever they have a problem and trust my opinion.